This presentation examines the functional medicine model. We will review its clinical claims, evaluate the methodological critiques against its evidence base, and analyze the systemic factors driving its adoption among both patients and healthcare providers. Conventional evidence-based medicine prioritizes standardized protocols, objective clinical endpoints, and brief consultations focused on acute management. Functional medicine counters this with prolonged consultations, personalized regimens, and specialized, though often unvalidated, diagnostic testing to identify purported root causes of chronic illness. Adoption of this model is largely driven by systemic failures in conventional healthcare. Patients, frustrated by brief appointments and unresolved chronic issues, seek the validation and definitive answers that functional medicine markets. Conversely, conventional providers experiencing institutional burnout are drawn to the functional model as an escape into a lucrative, out-of-pocket private practice framework. Proponents cite specific literature demonstrating positive patient-reported outcomes. Key data includes a large Cleveland Clinic retrospective cohort showing short-term quality of life improvements. Condition-specific studies indicate reduced inflammatory markers in Hashimoto's via the autoimmune protocol, improved physical function in inflammatory arthritis cohorts, and reduced fatigue in multiple sclerosis via nutrient-dense elimination diets. Independent researchers identify severe methodological and ethical flaws in functional medicine's evidence base. Key issues include the individualization fallacy, using customization to evade randomized controlled trials, and the package illusion, where practitioners refuse to isolate variables. Consequently, critics argue that positive outcomes are largely driven by the placebo effect, selection bias, and regression to the mean rather than actual therapeutic efficacy. Individual impacts include direct health harm from unvetted protocols and extreme psychological burden placed on the patient. Systemically, it creates severe economic stress through financial toxicity and drives societal erosion by mainstreaming pseudoscientific frameworks, which systematically degrades public trust in evidence-based medical institutions.